Hello. For this project, my practicum project, I took part in community-based clinical and public health work in rural Guatemala. So to go into a little bit of where this project exactly happened and what I did, this project happened, as you can see right here on this map, in Tecpan, Guatemala. For those that are interested in the geography, it's a little bit south of like the mainland. So to go over into more specifics of what we did, this was a trip organized by the Pre-Medical Global Brigades organization at our school. And so basically, we took a lot of the pre-medical students that were interested in doing this kind of work to Guatemala, and we paired up with physicians and dentists that were also willing to come. And we set up a kind of like a mobile clinic for a week. And so at this clinic, we had lots of stations where we offered services such as medications at very much lower rates, vital stations, and those were in combination with physical like physician consultation stations. So we gave like a lot of these community people a lot of access to healthcare services. Some of the more interesting stations that were a little bit public health related too were the ophthalmology station where we learn how to give someone a prescription lens based on their prescription, and basically this would help from a public health mindset because we're helping not just in an acute fashion but in a more long-term fashion where we're helping this person hopefully understand the importance of wearing glasses, the strain that might come from not having them, and maybe the betterments of giving these people long-term solutions. We also had a dental station where we helped with extractions and fillings, and we also taught people like proper dental hygiene. Again, from like a public health perspective, the acute care, which would probably be extractions and fillings, were I guess less important from a public health perspective, but the education that we gave them on terms of dental hygiene, I believe, was really helpful. Lastly, we also had an OBGYN section. Unfortunately, I was unable to work in this station just because of gender issues. But I think from a public health perspective, this was also really good as it embodied a lot of the preventative principles that we like to practice. So that's kind of a brief overview of what I did. The poster kind of discusses the same things in terms of what we did, and really, I think that's a good overview. So why I chose this site and project was because this site was chosen by the organization that we were pairing up with, so there was no choice there. But I chose this project of going somewhere because I've been learning a lot about these public health things in our classes, like all this education from receiving about how different countries are different, and every place has their own healthcare system. So I wanted to really experience it firsthand, and I also wanted to get an experience of what it might like be like being a physician in another place too. So it was kind of a way for me to explore some of the things we've been learning inside the classroom, and for me to also get a chance to explore some of the professional career goals I have. So kind of to take a more like better look at how this practicum related to public health. I think there were a lot of parts of it that were acute. It's a week-long clinic. We're providing a lot of healthcare services that are very acute. The medication that we give is acute. The consultation that we give is likely going to be something acute. But the long-term things were the education that we provided to people, the classes we provided to people, the preventative, I guess, screenings that we provided to people. All of these were very public health related. In terms of as students, we also got to learn some of the public health issues that this place was facing. So we also got to learn some of the challenges. Like for example, the community as a whole was facing, I guess, an issue with vision. So a lot of the women that would do weaving would really struggle with short-sighted vision. A lot of the farmers had long-sighted vision problems. So from a public health mindset, when I'm thinking about an intervention, perhaps I could think of, okay, as a community, this is an issue that's happening as opposed to just each patient or each person is seeing this. So I think it kind of trained us to think in a more population mindset if you looked for it. So I think overall, just kind of going into the public health and the, I guess, the specifics of this trip, I think it really helped just give us a perspective of everything. Some of the interesting things I think on this poster, you can see right here, this is an image of all the students that went. That's me right there. There's a bunch of other pre-medical students. These are physicians. This is a dentist. We also had the mayor come by, so we had a lot of support from the town as well. And I guess it kind of gave me an appreciation for how much this kind of work is valued and appreciated in these places. Um, Overall, in terms of any personal takeaways that I had or personal connection and how it informed my global health goals, personally, I want to be a physician, but I also really truly do want to work at the intersection of public health. And I'm not sure how, but in a space where I can connect medicine, the science behind it, to working with communities and not just one individual, which is also important, but I think I would want to work on a more population level. So this helped me inform that mindset because I really felt reaffirmed when I was working one-on-one with a patient. And I really liked that sense of being able to provide care to someone. But at the same time, it really motivated me to want to help a population as opposed to just an individual. I also just want to acknowledge, just as this video is coming to a conclusion, that these projects are not, I truly believe this are not the best way to help this community. I think with the funding that we received and the manpower that we had, I definitely believe there's a better intervention that could have been held. But I think at the same time, it was something that was very meaningful to me. It was something that really inspired me in this field. And I think it's going to be a long lasting memory for me. So I just want to acknowledge that while there's better things that I truly believe could have been done in terms of intervention, as a student, this was incredibly transformative for me, and I'm really grateful that I got to experience it. So thank you for learning about my practicum, and I hope you enjoyed, I guess, learning about some of the work that we